Hi everyone, I'd like to welcome you to the Wist webinar today called Help Needed. So I'd like to just briefly introduce myself before we start. So my name's Sarah, and if you've already been to the Therapy Expo, you had already met the other two members of the team who are Sonia and Gemma. Unfortunately, I wasn't there, and I don't know if you can still see, I've got a slight little tan. I've been away, not in this country, nice sunny climate. Um, so today's webinar, Help Needed, I'm going to explain to you in a second what that's all about. But before we go there, just a brief introduction to myself. So I'm a certified fascial manipulation specialist, an acupuncturist, and I work with traditional Chinese medicine. And that's all I'm going to tell you today, because this actual webinar is really not to do with what we do professionally, as in what our job titles are. It's more or less about things that may be going on with us personally, that we may need some help which is why it's called Help Needed. Okay, so let me explain to you why I joined the Wist team. So sometime beginning of this year, I got the email come through that Gary was looking for some volunteers to join Wist. And I looked at it and I thought, do you know what? I could really do something with that from a support and a community point of view. I feel that's something that I've been lacking in all the years that I've been working as a practitioner. And it really kind of, it kind of really spoke to me. And I thought, let's just see where this goes. And I'm really excited to be doing this webinar today, because it's going to give you an opportunity to understand what we want to kind of create. It's all in the early stages, so it's something that we really don't know where it's going to go, but with your help and your feedback and what you want is how we're going to navigate going forward. So help needed, what does it mean? I keep saying, what does it mean? Well, it's a funny statement, and I think the only way in me to explain it is for me to go through my journey, not as a practitioner, but my personal journey, which will help you understand the actual title. And I must say this to you, first of all, that there are going to be some topics that are not going to be easy. They're not going to be easy for me to talk about. So I would like to first of all ask you very politely that whatever is discussed here stays within this webinar, that you can just use it in the fact that you understand what the Wist project is about. There will be an opportunity for others to talk after I've, gone through my life, which may take 5 minutes, may take 20, but yeah, and I understand that not everyone can make it tonight, and that's completely fine, because we all work strange hours and long hours. So if you're watching this as a recording and at the end of it you think, I really want to ask a question or I'd like some more information, then please feel free to reach out, because that's really what this is all about. Okay, so there's going to be subjects on some baby loss, miscarriage, menopause, depression, anxiety, post traumatic stress disorder. What else have we got in there? Oh, maybe some bereavement stuff in there as well. There's quite a lot. And you may feel, think, why is she going down this route? And I'm hoping that it will be very self-explanatory for you. I'm not opening up to you for you to tell me that you feel sorry or whatever. I'm opening up to you so you can really understand why I want to take this on and really get a support network together, because I think it's really important that we have this for women with what we have to go through whilst trying to still continue to work as well. Okay, so let me start off by telling you that I'm currently in my menopause. I am 52. I've been in my menopause for the last 3 years. And I must say, before I hit my menopause, I was doing pretty okay. But the last year has been pretty not good for me, kind of mentally wise and physically, joints as well. But if I go back to the beginning of my journey, a lot of members in my family have always suffered with depression. It goes back a few generations. So I already know that I have got that gene, if you like. And when I was younger, I was diagnosed with an eating disorder. And this has followed me throughout my whole life. Now, again, you're thinking, why is she mentioning that? And it will all become clear to you as we go along. But so the eating disorder for me is binge eating. There are different types of eating disorders out there. We all have different things. The reason I'm mentioning it is because my body can change very quickly when I have a stress episode, meaning that I can go from having a very flat stomach to, in the next few days, to my stomach looking like I'm, 6 months pregnant. And when you have had fertility problems and you have that also on top of that, because you have stress and you have all this genetic stuff with, depression as well, it's very difficult when you're treating people for them not to be vocal, and the fact that your body may have changed in a very, very short period of time. So from practitioner point of view, it can be quite challenging for me, as I'm sure that others that have eating disorders can relate to, because we have maybe regular people that come and see us that notice how we change. We have people that like to be vocal and tell us that we've changed. And we've got others that just will stare at maybe your stomach when they come in, which can make you feel uncomfortable as well. So, you take that, and then you take, other things that are going on in your life as well. So periods, when you have heavy periods. So my periods, when I had them, were awful on like the first day. I couldn't do anything. I mean, I was changing a sanitary towel maybe once every hour. I had incredible discomfort, like a dragging sensation underneath, which meant I had to sit down. But I still carried on working, even though I knew that I was maybe, leaking while I was with a patient. I could, feel that happening, but I carried on working, even on my first heavy day. And while I was having my periods, I was quite fortunate compared to some people. I had the odd cysts here and there, but 12 years ago, I started my fertility journey, and unfortunately, I had a miscarry at 8 weeks, and that was very difficult, the first one, because I went, I had lost a lot of blood. I went and got taken to hospital, and then went home that morning, went to bed, went to work the next day. Not sure really why I went back to work the next day. Looking back at it, I think I felt like I had to go back to work for some reason. I then had a baby actually booked in for a treatment. I think that was about 3 days after that. Again, I carried on with the treatment. I didn't think much of it. But on the morning, I remember going to that person's house thinking, I don't want to do this, but I can't cancel because I have to go. Um, so that happened with that. And then it just the first one was kind of, got through it, but then my second one, which was a year later, I was I had to have a medical termination because the baby was unwell. It was quite late. It was 15 weeks, and it was the most, for me, traumatic thing that I'd ever personally gone through. Now, when that happened to me, it was very, very difficult because I I just lost it. I went in a dark hole. I couldn't come out. I felt very alone. I felt like um, I couldn't stop working. I felt like I had to keep going. It was just a really difficult time. And I had severe depression, but I kept working and I kept going on. And, my eating disorder was coming up, and I was having pregnant ladies coming in to see me because that's what I was doing at the time. I couldn't turn them away. I had to keep going. I had clients coming in asking me, when are you going to have a baby? Have you got children? It was just horrific. And I just felt really alone and I just didn't know really what to do. And then when my third one the following year happened, well, that just threw me over the edge. And it was just not very nice experience at all. So I've been very open with you, and I'm very sorry if anyone has gone through any of what I've talked about. And I'm also apologise now if it's brought anything up for anyone. But the reason I'm mentioning it is for you to understand that when you have a situation like that, for some reason, you don't put yourself first. You have to keep working. You feel like you have to keep working, that you can't stop, that no matter what, you have to see these people, you have to see that pregnant woman, you have to go and, see that baby. And when I got this email come through from Gary, the first thing I thought about was this. And I thought to myself, I really could have done with some help back then. Not from a counselling point of view, because I was, seeing a counsellor then, but from the actual fact that I could have done with some support. And if my younger self was here now and she saw that this Wist was being created, I know for a fact that I would have been really, really happy with it. Now, I could have spoken to someone like myself, another practitioner who would have got it, who would have understood the need in me to keep working, but the need in me to not cancel clients so that I could still get paid, so that I wouldn't be known as someone that was going to turn people down, let people down. And I think that if I would have been in if I would have been that person that my younger self would have spoken to, I know that I would have turned around and said to them that you need to create some boundaries and you need to decide right now how you're going to, get through this, and how we can help support you, how we can help you understand, that this is no good for you, that you need to create these boundaries, that you need to do this. And because if you do create boundaries, and if you do let someone else in to like have another look at what you're doing, then it can really help you in your grieving process. In fact, it can make it shorter rather than prolong what you're going through. So, for me, it was a no-brainer joining Wist and helping people understand that we want to create a support environment that can help women, whether it's with what I've talked about, menopause, whether it's periods, whether it's financial, whether it's you working when you've got your period, whether you've got a child and you don't know how to manage having a child. There's so many things now that we can, as a community, understand each other and talk about. And I know I've been very open and honest with you today about my journey, and my menopause has been horrible the last year. It's just I've not wanted to work. I've not wanted to go to work. I mean, in the jobs that we do, we listen all day to people, and some people tell us everything, and I'm thinking, like, I don't want to listen to that. I really don't want to listen to that. And I lost my fire. My fire in my belly went for about a year, and I thought, I don't know if I want to do this job anymore. But it came back. I gave it time, and it did come back. But again, I could have joined a group in Wist, and I could have spoken about it. I could have been honest, and I know no one would have judged me for being honest, because we're in a world now where we can talk about these things. We can talk about periods. We can talk about menopause, because it affects all of us, and it's just something that we can do. And to create that community that will help us, talk and listen to each other would be absolutely amazing. So that's really why I decided to join Wist, because I want to create something where people feel safe, and they feel that they, can say whatever they want, like what I've said, whatever I want, as brutally honest as it was. And that can be quite difficult for people to hear. But for me now, I just want to say I'm in a much better place, and I treat pregnant women all the time, but it's taken me a long time to get here. And I'm very content in that. I do a lot of gynae work, and 70% of my work is with women's health, and I help women try and have babies, and I love it. Would I have loved it 11 years ago? Absolutely not. I love it now because I'm in a really good place. So I think that it's there's so many things that we have to do every day to get by as females. And the depression side of it is real. It can happen when women have their periods. Obviously, PMT, you can definitely get it in the menopause. Equally important that we can learn how to manage. So what can we do as a support? Well, we can do a few things. We can create a safe environment for you to talk openly and freely. So for instance, today, if you're kind of listening to this and you're thinking, I really could do with some guidance and advice. I'm feeling really, I don't know what to do at the moment. I've got financial problems. I'm not sure. My periods are really bad, and I'm finding it difficult to work. Then we're here to listen to you, to talk openly and freely, and with that information that you give us, if we can't help you find a solution, then of course we're going to try and find external help for you. We don't have all the answers. We're not the experts here, but what we can do is try and just give you the support that you need. We will listen to you, We will listen to whatever it is that you want to say, and we can help create boundaries that are causing you problems. So, you know, my old self would have gladly loved someone to have helped me create boundaries by saying to me, Sarah, for God's sake, no pregnant women for a while. Just leave it. And I would have welcomed that with open arms, but I just couldn't see the wood past the trees at the time. And when you're in that situation, you just can't. You can't see it. Um, and everyone deals with things differently. Some people are stronger than others. So that's, you know, that's another thing. But, you know, we can also help you find like-minded people that can help each other. So, you know, I'm not the only one that's gone through what I've gone through. There are people I know in the STA that have gone through a lot worse than me, and I also know that people that have gone through stuff that I can't even contemplate. But together we need to talk about this stuff. It's important. You know, I think it's really good to just take a moment to see how our clients, patients perceive us, because in my mind's eye, my patients or clients see me slightly differently to what to what I think. And sometimes I get the impression that I think that I know everything, that I've got it all sussed, nothing's going goes wrong in my life. They look up to me. Of course they look up to me. They're paying me for some advice. And when you're in that situation where you're going through something, like for me last year of my menopause, where you think I can't do this anymore. You know, I can't listen to you and guide you because I just can't guide myself at the moment. Then it's about, can you actually tell yourself at that point that I need to take a step back and I need to take a breather. And I did actually manage to do that myself. However, if there was, you know, a group chat that I could jump on, then I could actually ask that question and say to people, you know, are you managing this? Are you able to step away and observe what's going on with yourself? Are you able to nurture yourself properly and look after yourself and take that time that you need? Um, you know, are you able to? Can you financially? Because again, that's another thing. Can you financially pull back when you need to? So you know, the other thing is, can you prioritize your work? Can you learn to say no? That's one thing that we definitely need to strengthen ourselves on, is to say no. No, I'm sorry, I'm not going to work that time because I need that time for myself. No, I'm not going to see that person because I'm not going to see pregnant people for a while because it's a trigger for me and I need to get well before I can start seeing, you know, pregnant people again. It's okay to say no. You know, it's okay for you to say to yourself, I've got a really bad period on my first day. I'm not gonna, I know when I'm coming on, lucky for me, I know that it's gonna be in 4 weeks' time. I'm gonna make sure I don't work that day because I know it's gonna be very difficult for me and I can't give my best to what I want to do. And that's okay to make sure that you've got that as a priority. It's okay to prioritize yourself. You know, I'm going to the dentist in a couple of weeks, and the reason I'm telling you is because my dentist is only there on a Monday lunchtime, which is a right pain for me because that's my busy time. And I thought, but I have to go and see him because I don't trust anyone else with my teeth. So I've had to make a commitment and book him in. And people are like, but I want Monday lunchtime. Like, but you can't have Monday lunchtime. You can have then. The old Sarah would be like, do you know what? I'll do my teeth 6 months' time. The new Sarah's like, teeth now. Because if I don't now, then when am I going to? So again, that is about prioritizing and learning to put things, you know, for yourself at the front. I think that, you know, life is always going to throw curveballs at everyone, but for women, it's definitely double curveballs with the whole gynae stuff that we've got going on. And it's we're very lucky now that we have a lot of scientific background, especially around training, to say when's a good time to train, when women shouldn't be training around their period, when they shouldn't be, when they should. And now I think we're in that time where we can actually say, you know what, I need to take more time for myself when I have my period because I know how my body reacts. I think we're in that time now where we can say, I need to take a step back just for a little while to make sure that I heal properly. I think we can now take a breath and step back and say, yes, I'm in my menopause and I'm struggling. And it's okay to say that you're struggling. We're not gods, practitioners are not gods. We're the same as everyone else, and we all have same stuff going on in our lives. Um, I feel like I've been waffling a lot, and actually, I don't think I've sworn yet. I'm really impressed by that. I do like a good swear, but I think I've really gone through everything I wanted to talk about today. Um, yeah, I just want to say that I hope that you don't mind me being honest in the beginning. I think you can hopefully see why I wanted to join Wist and how important it is for me to join Wist so that I can make sure that women have a voice in how we work and women have support, knowing that they can contact someone and just pin us a quick question. You know, I'm not sure about this. And yeah, I think it's amazing that we're doing this because, you know, we're we get on with it, we're silent, you know, we just have to do things, but we don't have to be silent anymore. We can talk to each other. And that's the beauty because we're all the same. There's no one in Wist that as a whole, as members that are different than anyone else. We're all on this journey together. So I think it's really important that we all stick together and we all look after each other. I think that's me. I think I'm done talking. So I'm going to keep quiet for a little while and see if anyone wants to talk for a bit upon reflection, and let's see what happens.
Hi, Sarah.
Hi
Yeah, if you
Gary, how
want
you
to,
doing?
let me just turn my camera back on 1 second. Yeah, I was just listening, and all I heard was you're going to remain quiet for a minute. If there's anything you'd like to add, or if Amy Louise hasn't got any questions, then we can move on. I don't know where you wanted to go from here. Amy Louise, have you got any questions for Sarah?
No, no questions. Just wanted to say thank you for your honesty. It's really appreciated.
Thank you, Amy Louise. I really appreciate that. That's lovely. It's not easy, is it? Saying this stuff,
No.
and but we're all in it together, and that's really what I want to get across is that, you know, everyone's got stuff and we can all support each other in whatever we're doing. And that's really what I want out from today.
think at the risk of repeat, because I wasn't listening, I've been preparing legal papers in the background, but at the risk of repeating what Sarah may have said, that the reason that we're pursuing this project with the ladies on the Wist project is that, you know, we are male heavy at the STA office, and sometimes I don't think that some of our female members might feel safe sharing information or asking questions, and that's why it's really important that we've got Sarah, Gemma and Sonia to be able to offer that support either through these education type recordings or in the mentorship groups or personal groups on a one-to-one basis. So that's the reason that the girls are here. I hope everybody takes advantage of it, because as Sarah said right at the very beginning, you know, we don't know where this is going. This is an open-ended journey, and we are prepared to, I'm personally prepared to support this, so that we are supporting our female members adequately. I've spoken to a couple of our female members this week who've got some, shall we say, vulnerability issues regarding, you know, toxic workplaces. And I find it very difficult to engage with them because, you know, I'm a 6'5" ex-army ex-rugby player. So it's difficult for me to understand, you know, what they may be going through. And again, this is one of the reasons that all the girls were involved. But I'll let you finish up then, Sarah. Thank you.
Thank you, Gary. So I'd just like to say that if anyone's been, you know, if you've tuned back into the webinar, first of all, thank you for watching, and we're all here for each other. So if there is anything that you want to talk about, that you're struggling with, please do get in touch. And also, if there's anything that you'd like us to, you know, to talk about, I mean, we could do subjects, you know, just throwing it out there. If there's a particular subject that you want us to talk about, where you get a chance to kind of join in, or if you do have any questions, please feel free to get in touch. But remember, we're all in this together. It's not just one of us, it's all of us, and it can be a really good thing to just start opening about things, to make you a very stronger person, but also a better practitioner in the fact that you are learning how to deal with your stuff in a more positive way that will, you know, make you better at what you're doing. So yeah, I just want to say thank you for listening, and I hope it wasn't too raw for you, but thank you so much. Thank you.
Thank you.